Hello, welcome back to my YouTube channel where we talk about the basic medical information making a big difference in our lives. Many times people ask, especially those who have what we call high blood pressure condition, when will I stop taking this medication? Today's video, we are going to look at some of these questions and the many questions people ask. Before we continue, remember to subscribe if you are a returning subscriber. Thank you so much for always coming back to watch my videos. And if it's your first time, don't forget to subscribe also. Hit the notification bell so that you get to be notified each and every time I upload a new video. And my name is Rebecca Morangi, and this is the best place to be. Yes. Before maybe we get to answer the question, let's start by knowing or getting to define what we call high blood pressure or hypertension. And before we go on, some of these questions, especially in my day-to-day activities. Remember, I am a farm tech, and my life most of the time have been majoring on dispensing. And some of these questions are being asked as we dispense this medication. When you say you have high blood pressure, actually this is elevated blood pressure in your body. And when we say you are hypertensive, this is chronically elevated blood pressure. The normal blood pressure should be between the systolic or systolic, which is the top number, and diastolic, which is the lower number, should range between 120 to 140. That is systolic, the top number. And the lower number should range between 80 to 90. That is diastolic, the lower number. So you should maintain, all your blood pressure should be maintained within that range. When we say now it's high, it's when it's above 140 and above 90, above 140 and then over 90. And then what we should know, the reading, actually it's the reading of, it reads in millimeters of mercury. So when it's above 140, we say your blood pressure is elevated. Now the question comes, should I worry about these numbers? Many times, many people have elevated blood pressures, but they don't even realize, because some don't even check. But remember, these people, they don't even feel any symptom. And most of the time, some of these condition, or this condition doesn't even show symptoms. That is why it's called a silent killer. So if you have your blood pressure elevated, but you do regular exercise, you eat well, you do not take alcohol, you do not smoke, you are not maybe obese or overweight, that is why some people can sail through, because they are doing what is right to maintain this condition. But when your blood pressure is high or elevated, and then you do not exercise, meaning maybe you are overweight, you smoke, you take alcohol, you take a lot of these what we call processed foods, you take a lot of sugar, you take high salts, you fall in a very dangerous category. So it's good to take note of this. The numbers sometimes should not worry you if only you do what we have already said. But if you don't, you should worry about the numbers, because one day you might find yourself in a difficult situation. Take an example. You have your car. For your car to work for you well, you have to take good care of it, and it will take good care of you. It's the same case to our bodies. When you take good care of our bodies will do us well also. Another illustration, you get into a matatu. We have traffic rules. Many times we are told when you enter into a matatu, fasten your safety belt. If you don't do, and by bad luck, the vehicle maybe gets an accident, what will happen to you? You will get injuries. You will be at a very dangerous position as compared to somebody who has already taken seriously the traffic rules by safetying the safety belt. Why did I bring this illustration? It's the same case to our bodies. If we take safety precautions, lifestyle precautions, we'll be able to prevent ourselves from entering into difficulty situations. You exercise, take good diet full of vegetables and fruits, but low in fats, so that you lower your cholesterol level. And then you take low salt, especially the sodium, and then you manage your stress well. You will be able to sail through. You not find yourself in a difficulty or a dangerous situation. But when you just eat anything, high processed foods, you smoke, you take alcohol, you do not exercise, you are in a very dangerous situation. So it's good to take such precautions. And also, what are the symptoms of this high blood pressure? Many times high blood pressure doesn't have actually symptoms. That is why it's being called a silent killer. Yes, some people may have what we call shortness of breath or chest pain, but which is minimal, not to many people. That is why you can have, I said, elevated blood pressures without even knowing, because many times there are no symptoms unless you go and get checked. Some people have given testimonies on how they have stopped taking these blood pressure medications, if we answer the question we started with, because they liaise with their personal doctors or their family doctors, and then they take lifestyle changes, low salt intake, regular exercise. They reduce alcohol, or they stop taking alcohol, stop smoking, they stop taking sugar. Many people have stopped taking this. But remember, one dangerous thing you will ever do is to stop taking your medication, if at all you have been put into these high blood pressure medications by your doctor. If you make a mistake by stopping abruptly without the advice of your doctor, that is very dangerous, because it may relapse and then come back, which will be a very bad thing to you, which will be very difficult again to maybe to lower it. But again, the blood pressure actually may be elevated again because of different health conditions. So it's good to take precautions. Don't stop the medication unless your doctor advises you to stop. But if you have to stop, you should get hand in hand with your doctor by taking the lifestyle changes. Actually, those are the alternatives of maybe stopping taking some of these medications. And remember, some of these medications have side effects. Some people get hunger, or sometimes they're depressed because of the side effects of these medications. So each and every drug actually has got side effects, but some are minimal, you cannot even realize. So it's good to follow your doctor's instructions. So who are the people now who should worry about this high blood pressure condition? One group is old age. As you get old, some of these conditions actually, they just come up. And if you have not maybe adapted to these lifestyle changes, mostly. Another thing, physically inactive people, those who do not exercise. And I recommend, we have been talking about advantages of exercising in our previous videos. What happens to your body when you do regular exercise? Kindly go back and check. You will be able to know the advantages of exercising. So old age, people who are physically inactive, family history, that's a risk factor. If you are obese or overweight, you should get worried about this thing. But if you practice the lifestyle changes, you will not be in this category. But this family history risk factor, sometimes you don't even have power over it. But you can sail through if you follow the lifestyle changes. Among the many questions you are going to answer, we have answered actually many of them. But what the causes of high blood pressure, we said it's high salt intake, being obese, alcohol intake, plugged blood or the arteries, and then lack of exercise, smoking, and those who take birth control pills. Most of them contain estrogen, and estrogen has got salts in it. And what happens, especially the sodium salts, actually, they absorb water. Your body will retain a lot of water, and then in return it will increase the blood volume, which will make your heart to pump with on a high note. Hence it will bring this what we call high blood pressure. And that is why we said sometimes it's good to take fruits and vegetables. Fruits and vegetables, they have what we call potassium. Potassium will help you to lower your blood pressure. So it's good to get to know which type of fruits you are supposed to take. So if you take the courses, and then in return you look at the lifestyle changes, you will be in a better position to manage your condition. So people ask again, do these drugs really cure this condition? What actually happens, these drugs, they manage your condition. That is why you take them, or many people take them at their lifetime. So most of these drugs, they manage your condition, and that is why you take them the whole of your life. So it's good if you take serious the lifestyle changes, so that you get to maybe to prevent yourself from falling into such situations. So the alternatives we have said, it's good to exercise regularly. And we said the best exercise, actually, you have aerobic when you involve your heart and your lungs. And then, yes, you have the anaerobic where you lift the heavy weights, where you burn your fats to release energy. Remember, the other one uses oxygen, the aerobic one. But this other one, you burn the fats. So these two exercises, they are good for those people who have blood pressure conditions. For example, if you are obese, if you burn the fats, in the other side, you are preventing or lowering the risks of the high blood pressure. So again, avoid processed foods, because some of these processed foods have a lot of salt in them. Those who go to the supermarkets, be very careful of what you buy, especially the snacks. Many of the snacks, they are highly salted, so that they taste, actually these are added salts, so that they taste well, but they have low nutrients. Actually, at some point, they don't even have any benefit to your body. Reduce sugar intake, lose weight. That is the best thing. You can decide to jog in the morning, walk 30 minutes, 5 days in a week. This is around 150 minutes a week. You start slow and then you improve. Make it a habit. Choose an exercise which is better for you. You will be able to manage this condition. And again, you can decide to take raw foods, fruits and vegetables. Because many times, if you cook vegetables and you do not overcook, you will need a very low amount of salt, actually. Rather than when you comparing to when you overcook your nini. So it's good to not overcook your vegetables. You will use little amount of salt. Again, you can flavor. People have gone ahead by flavoring food by the use of lemon, garlic, parsley. They avoid the use of these sodium salts, because we have done what sodium does to our body. They absorb a lot of water. They retain a lot of water in the body, and then increasing the blood volume, and then hence your heart will pump, or will need a lot of energy to pump this. Hence, your blood or your pressure will be elevated. So it's good to take note of that. And then if you have to take snacks, especially those who like snacks, go for unsalted ones. I believe, yes, they are there. So don't take the salted ones if you have to take. But if you can avoid, well and good. We said blood pressure drugs have got side effects. Anxiety, irritability, depression, fatigue. So what is better? We fasten our safety belts by the lifestyle changes, or we do what we want and then we wait for whatever will happen. It's good to prevent. So the best thing to do is to prevent before we reach at a position to manage the condition. Remember, we said your health is your priority. Take good care of your health. Yes, it doesn't matter. Other people say it's my body. Whatever I take, it doesn't concern you. Yes, it's your body, but remember, it's not good to get into trouble and then you start regretting. All of us, let us start practicing lifestyle changes, exercising. It's not difficult. It's good to tune our minds. Let's have positive minds in regard to our health. So in today's video, I believe we have learned something. Hypertension is when your blood pressure is chronically elevated. when it's above 140 and below 90 millimeters of mercury. And then you should keep it within the range of 120 to 140 over 80 and 90 should be maintained. And if you see any dangerous, maybe you get to know there is something which is not well with you, get to seek a medical doctor. In today's video, all this actually it's for informational purposes. It's good to have this information. It's good to have the basics. Yes, we have qualified doctors, experts, of which we should use. But before we go onto them, let us do the basics. Let us lay the foundation. Let us not wait for something bad to happen to us and then we start regretting. So I believe from today's video, we have learned something. And if you think, or if you think this video maybe it's good to be shared outside there, kindly share the link widely with your friends, your family member, all the people whom you think they should get some of this information. Information is out there, but it's good to take precaution. Remember to subscribe if you are new here, and don't forget to hit the notification bell so that you get to be notified each and every time I upload a new video. Thank you so much. Let's meet in the next video. Bye bye.